Well, again, my name is Kyle Schejbal. I am the sales manager here in Phoenix, or Gilbert, I guess. Like I said, we're part of the Mesa chamber since last year. Um, Ed, I think we've actually met before. Myself and actually one of my employees, Nate, actually came and visited you once before too, and we kind of had a conversation before about what you guys do and um, kind of what we do as well. So welcome everybody. Just I guess as like a show of hands, who owns a business? Awesome. Right on. Well, so really about group management services. Let's click this. So just some of the things we'll go over today. Just some of the payroll services that we, how we currently do payroll. Um, how our benefits are a little bit different than, maybe that you'd see in the open market, especially for businesses. What that risk management looks like, and then as well as HR. So really our mission, the why behind it. So, making your business operations simpler, safer, and stronger. That's our motto. The how, so having that dedication to our employees, clients, service offerings, and then the what, providing, HR tools, resources, and as well as the benefits where, we are a little bit different than just the open market. So we're going to jump into human resources first because I have Tori here with me. Tori introduced herself in the beginning. So I'll turn it over to her.
Absolutely. So a lot of what a big piece of partnering with a PEO or professional employer organization is HR compliance. So yes, there's all these other pieces and parts that Kyle is going to go into, but my team handles the day-to-day interactions with our business owners, our clients, our point of contacts, and supports them, obviously making sure that they can get the right things to the right people within our organization. But also the biggest piece of this is the HR compliance. So I personally have been with GMS for mine's 9 years in August. I have very much grown my HR knowledge base. I'm also a certified professional in human resources as well. So I am certified, and I handle HR in all 50 states, which is very, very complex. So even though I am based in Tampa, Florida, as I mentioned before, I handle West Coast. So our Gilbert office there, which we centrally notifies Phoenix because not everybody knows where Gilbert is, but I do. Great food. That's my favorite part of visiting. Kyle knows I always have a nice spread of food. But one of the things that my teams do is just kind of navigating this constant evolution of HR compliance and laws. So right now, for example, show of hands, is anybody well versed on everything that's happening with the FLSA and the salary threshold? Anyone? No? Yeah. It's not a fun topic. So on July 1st, for example, the salary threshold to be exempt from overtime for employees went up to almost $44,000, but they still have to meet a duties test. That means if your employees were bona fide meeting an FLSA exemption and were paid underneath $44,000 a year, they either needed to go to an hourly position and entitled to overtime, or they needed to raise their salary. Then on January 1st, of 2025, it'll raise again to almost 60,000 a year. And this legislation obviously are things that really impact small business owners because payroll is one of the largest dollar amounts that you have on your line items. But that all falls under the umbrella of HR and FLSA and pay compliance. So I kind of want to just start with that just to kind of see what it is, because that's why people hire us. They hire us to keep on track of the laws, making sure that we're understanding compliance, making sure that we're keeping you guys on the loop when major legislation changes that'll affect your business, and especially ones that could be costly. So just a little bit about what my team supports. Obviously, we have a robust platform that we have branded as called GMS Connect. It is our HRIS system. There's lots of functionalities in there, from PTO tracking, electronic onboarding, benefits onboarding, scheduling, pay stubs, all that other good stuff that we kind of have, as well as event tracking, which really helps with unemployment compliance. Just noting, I mean, I can't hardly remember sometimes what I did 2 weeks ago, let alone what my employee did 2 weeks ago. So it's important to have tracking methods to do that. But not only do we have you, or you have the tools to track within our systems, but we also can help you with those things. We also have a ton of HR support from the performance management area of things. So even though this list on here is a little small, it is way more robust than that. So from a technology platform standpoint, we have additional resources through learning management systems, through electronic performance management systems, expense tracking systems. So we have a lot of extra HR support in that realm, but also if you don't have tech savvy employees or you don't want to go down all those routes, our job is to find tools to streamline those processes so you don't lose sight of them.
Trish, may I ask, or Kyle, what system are you using? Are you using Oracle? Are you using SAP? Are you using PeopleSoft? What is it, your
For
own,
the in general platform. So
your
right
HRIS
now,
system?
yeah. So right now, we partner with Prism, but we're actually moving Prism to Pro software. We have found that their functionality and their streamline is a lot better. So believe it or not, we've been with Prism for a very long time, which is a very well known in the PEO brand. But we've decided to kind of take it on our own reins and give our clients more of what they want to see. So Pro software has been a beautiful partner, and we're in the middle of a beautiful transition with them. They're very receptive to the things that our clients need and the customization aspect, and we wanted a simpler platform, and the reception has been fantastic. They also have an open API, which has been a really, really good piece for us, where Prism had a little bit more of restrictions, and some payroll companies do have, a little bit more restrictions on what they can connect with. We wanted as a PEO to be able to have more connections to be able to serve our clients. It also has a built-in timekeeping feature in Pro software, which is really nice as well. It's not an extra piece of it that has to integrate in, which we have really loved amongst all the other normal things. But again, it's that streamlined user interface that we're really, really happy with right now. And I've been on Prism for, again, about 9 years. So I'm very used to the software, and I am obsessed with where we're going. So, and technology is scary. So, it's not my first time moving, full payroll platforms in an organization. So, and I've used a few of them, but I am really, really excited with the direction of Pro. Excellent question. From a learning management system standpoint, just to answer some of your questions there too, on that, we partner with Cornerstone for that. They have a very, very large, they're pretty recognized. So yeah, very, very large library, and we can also customize content too, which is fantastic. So a lot of what I do is obviously help translate a lot of these FLSA compliance laws. We're doing handbooks, we're doing job descriptions, we're helping through those tough conversations with discipline, but we're also helping with all sorts of different things with leave administration, FMLA compliance. Again, I handle, sometimes we have business owners that have employees in this central location, but also might have a remote employee in another state that they're not really familiar with those laws. That's kind of been the change since 2020. And that's the stuff where I kind of we have my expertise in, and that's where we really, really service our clients differently in that sense, because we might have one employer that operates in 18 different states. Just because your home base is in Arizona, I don't want you to not have the freedom to branch out and also be afraid to go in those states and not know what you need. Those clients are leaning on us to make sure that they have what they need. We also have full service recruiting, employee assistance programs, unemployment claims management, lots and lots of training and development. That's probably my favorite part. Even though HR gets the bad rap for always getting people in trouble and terminating people and, the bad stuff, I am a true, firm believer that when you invest in your people and the right training and resources and expectations, good question, Ed. I'll answer that in a second about handbooks. I want to retain it. It costs a lot of money to hire, retrain, especially good people. I want to know why they stay, and I want to keep them there. So our focus is really more on training and education, but of course you got a bad apple, you need to kind of exit gracefully. That's where I'm also going to help on that side. Ed asked a question about our handbooks being cookie cutter. They are fully customized. They are federally compliant, and then we make them state specific compliant or break those things down, and then obviously integrate any custom policies that our clients have. Anything from credit cards to inclement matter. I'm I'm in Tampa, so I do a lot of things in Florida with hurricane preparedness. But Arizona, we deal a lot with PTO compliance, making sure your PTO plans are compliant with state laws, amongst all the other types of things, leaves, ADA, medical leaves, FMLA compliance. But sometimes it's as simple customer service policies. We have everything drilled down to pretty much whatever you need, down to you can't wear this to work because I said so. Obviously within the law. So we will fully customize that for them, as well as job descriptions. Job descriptions are also fully customizable. We do it for each individual position with that are also FLSA and ADA compliant. So that is a tricky one with ADA compliant wording. Fun facts. So that's a little bit about what I do. Cost, as far as cost goes, those are individualized by business. So Kyle can talk a little bit more on that part from a cost, because he handles all the quoting aspect. But there's lots of factors we look at, from employee count to gross wages, to what services that you're offering and what packages. So Kyle, if you want to kind of take that one over, and of course, if you guys have any other HR questions, I'm happy to do that as they come up, and Kyle will turn it over to me if he needs me.
Awesome. I don't see
Yes,
the
we do work
chats
with
anymore.
hemp and THC. Yeah, huh?
Where are the chats coming in from?
I'm
I got
seeing
4
them pop up at
screens
the
in
bottom.
front of me. I'm not gonna lie, I got 4 screens and none of them have a question on them. So
Oh, okay.
one
So
time
Ed
is
asked about
missing.
cost, and then he also asked if we work with THC and hemp clients. We absolutely do. I actually oversee a very, very, very large marijuana client down in Florida with grow house and full distribution. So, and all the fun stuff there. That's a very fun industry to handle.
Awesome. Thanks, Tori. Yeah, if anyone's had any more questions for HR, I know Tori's gonna hang out. She's kind of our matters expert, whereas I'm just the one that sells it all, right, and quotes it all. So how our payroll works, how it actually works is what we are is we're a certified PEO, so we're certified by the IRS. What we do is something called co-employment. Co-employment, it's very based off the PEO model, where instead of you running your payroll through your federal tax ID and getting hit with any kind of audits or anything such as that, it actually falls underneath our federal tax ID. So we work so close with the IRS that we lose that certification if we didn't do it correctly, right? So some of the payroll services that we offer, so as Tori was talking about, our HRIS system. So not only will you as the employer, but your employees as well, have that system. They have the system, the employees do, where they can go in and see pay stubs, W-2s, they can put in PTO, they can do trainings through there, they can see what benefits they're currently offering, or not offering, what they're currently partaking in, how much it's costing them each month, right? Then also you as the employer, seeing exactly how much that costs as well, exact participation, and so on. Electronic onboarding as well. So that electronic onboarding, instead of day one, an employee comes in and would sign up with a piece of paperwork, and it's 2 hours of their morning where they don't know really what's going on yet. Instead, what we do is we send an email. The email would go to them directly first. That email then would show up, that email that they would sign up with. They'd go through everything with their normal tax portions, direct deposit, any kind of regulations or anything like that. And then any thing that you would need too on the onboarding. So obviously signing off on anything that, for drug tests, background checks, and so forth. And then also time and labor, one of the main things too. So if you have employees clocking in and out of the office, we also offer a geofencing as well. So, employees can't jump on their phone and click "I'm here" when they're, 2 lights away and they're running late for work that day. It being geofenced, then they're able to see that right away. You're able to see that right away as the employer, and from there, you can have your direct conversations about stuff like that. And then we also have a GMS Connect app too, so that employees don't have to just be on their computer just to look at that kind of stuff. I mean, payroll's payroll. either we get it right or you don't, right? That's what we always say all the time. Anyone have any questions there?
I have a question for you,
Yeah.
Kyle.
Yeah.
So do you use like a hire right to make sure that you know, the social securities are right and the drug testing, or is, I mean, and who do you connect with out of your system?
I'm sorry,
Just inside.
I couldn't hear you. I'm so sorry.
Oh, no, it's fine. No apologies necessary. So when you are doing your drug testing, your employee verification, things along those lines, are you using an outside firm?
I'll take it, Kyle. I was like, that's a me question. So for all of our background checking, drug testing, we partner with a company called DSAS because they can do electronic
Okay.
compliance for
Sure.
things. So yes, it's a third party.
Third
There are
party, okay.
a pass-through cost for those ones because again,
Yes.
it's not like not every client needs it. So
Right.
we offer it at a
Like
discount rate.
your e-verification, your drug testing, things like that.
We do e-verify for
Okay.
free. We're an e-verify agent as a PEO. So everything we do from that standpoint, a client has to sign an MOU and then it's actually built into our electronic onboarding process. So as soon as they
Okay.
have a new hire done and the I-9 is complete, it automatically gets run by our e-verify team through the e-verify system. And then our teams would handle any non-confirmation, tentative non-confirmations, etc. That's a very big compliance piece for Arizona because you are required.
required.
Yes.
Okay.
So yes, we will handle all of that for you. That's not a problem. And then yes, background checks, all that stuff. If you do drug testing, we have those things as just an a la carte little extra thing if you need them. And then from a recruiting standpoint, from those aspects, we have actually an all-in-house recruiting team. We use Applicant Stack presently. We're actually working on getting an ATS to integrate. Another big reason of why we're moving to Pro because we want an ATS that everyone can use, not just us.
Okay.
So
Okay.
we currently manage it all for them. Does that help
It
answer your
did.
question?
It did. Thank you, Tori.
Awesome. And then I know that Ed was asking about pricing and everything too. So again, pricing all really just depends on employee size, you know, gross wages for the year, what other, systems are you taking from us too? We put everything into place. All these things I are mentioning, these are all part of our normal, like simpler package. But we also have two packages. We have simpler package, which is so far everything we pretty much talked about. And then you have your stronger package as well. Stronger package is really based on growth of the company. If the company is trying to, really grow in the next 6 to 12 months, that has a little bit more of a all-inclusive package. All right, so with benefits, one of the main things I mentioned earlier is we're a little bit different than the open market. The open market, you would go in and you'd fill out age, weight, smoker status, height, weight, and that's it, right? And you'd get your rates back and maybe you'd see a 20% increase, this year and maybe only, 8 or 9 next year. And then maybe you got another 20% increase the year after. So what we have is called our master healthcare plan. Our master healthcare plan is exclusive to group management services and our employees that are on the plan and companies that are on the plan. What that means is we rent the Cigna network. And it all depends on if you have a certain amount of employees that are on the current healthcare or not. But we do something called a personal health questionnaire. That personal health questionnaire, we get the actual health of the group compared to, again, just average, height, weight, smoker status, right? And then what we do is we actually take that health of that group and we buffer it against the other 23,000 lives that we have on our plan currently. We also offer other little things too, all the ancillaries. So dental, vision, long-term and short-term disability. We also have teledoc as well, for all of employees as well. We claim audit. So one of the main things that we always have, our benefits specialists they talk about is, say you're going in for a surgery. That surgery is then, they come back and say that's going to be $100,000 surgery for XYZ. So our team will then go in and talk to, Cigna and other, hospitals and figure out exactly what, maybe through a different, carrier or something like that would be a cheaper price for that surgery. And then we would help, manage those, claims for, if it's a surgery so expensive, we can, help bring that surgery down, if that makes sense. I think I rambled and it didn't make any sense, but as I keep talking, I'll remember what I said and reverse back, I promise. We also offer, we can offer over 15 different plan designs, from, high deductible plans to HSAs to, so on and so forth. So, and again, it's all depends on you as the employer, what you're looking for, exactly fitting what you want for your group, for your people. And then from there as well, you can choose what plans you want for dental, vision, long-term, all the way through pet insurance. And then we also offer 401k through Transamerica. And I'm sorry, I know I just rambled for, 48 seconds there. Any questions on how our benefits is different than the open market?
I was wondering if your pricing is dependent on the health of the group. It sounded like that was what you do if you're taking medical records for people. So if you're healthy, your group can see a benefit because it's a healthy group. But if they're not healthy, does that have a negative effect on the benefits cost?
Kyle, I can take a lot of the benefits things. So our plan is medically underwritten, which is a little different than a mass plan. And I know, Ed, you have a lot more experience in benefits and things like that. So this probably makes a little bit more sense than you to you. So because
It's
we are
level
able,
funded. Is it level funded? Is that what you guys use? Or is it a party
it's self-funded, it's fully insured on the front side and then self-funded on the back side. So we're technically a self-insured employer on the back end, but from a front end, from a client perspective, it's fully funded. That's just more so the logistics and the background of it. It's just why certain areas we're able to do medically underwritten plans. And the reason why we chose that is because kind of to what Kyle's point was on insurance rates, and next year you end up getting a 20% increase. When we're able to actually look at the total health of the group, we're able to properly quote where you should be, so you're not being brought in on a very limited amount of information. You're being quoted accurately. Now, throughout the course of the plan year, we're also doing status checks around the 6-month mark, utilization, without giving obviously personal employee data, but saying, hey, you have a lot of people going to urgent care for something that could be used for telemedicine. Why are they going to urgent care? Do we need to do a refresher on those things? Because our goal is to keep claims costs down for things that could be controlled, so we don't have 20% increases. Obviously, healthcare is one of those things that no matter what, every year you're going to have it. And of course, if you have a really rough year, you may see a bigger increase, but you're not going to see the 22%. I mean, you really have to have a tanked plan to end up having that. What we do instead is spread that risk out through the other 23,000 lives. So, maybe this group had a really good year, so we can actually not give a 20% increase. We're going to give a 13% increase for that really rough year for that employer. So we're able to not have to do it that sense. But again, we're also looking at, we're trying to make that education aspect throughout the year in case your utilization is completely awry. Of course, healthcare is healthcare, right? People are going to get sick. That's what we healthcare for. Cancer diagnoses, chronic conditions, etc. But we're going to be looking for, those things to properly rate your group so you don't have a shock at the end of the year. So it's just a little bit different. Good question. Did that help answer your question, Ed?
Well, yeah, it did. But, because it sounds certainly like level funded programs that I see all the time that are medically underwritten, that have reinsurance piece that covers it so that, you know, there's no out of pocket to any of the clients. So that's what it looks like to me, you know, when you're talking about a medically underwritten program as opposed to an ACA sanctioned program that's the same price for everybody that's in a certain zip code, that's got a certain sex and a certain age. So yeah, that's a good strategy. It can help you and it can hurt you depending on whether you're healthy or you're not healthy, or if your big group is really healthy or it's not healthy too. You know, you could have some major losses. So it's always nice to be able to spread the loss ratio out. And you guys probably are, you know, more going to be on the healthier side than on the non-healthy side, just by the numbers figures. But that's what it seems like to me. And I use the level funded program quite often. So I think you guys have a very similar strategy as what I have, which is kind of nice.
Yeah, yeah, absolutely. And yeah, I mean, I've got self a shot at the back. Of course, we have a reinsurer because you never know what kind of catastrophe. You're right. God forbid all 23,000 lives have a terrible, terrible, terrible year. That's statistically, hopefully an anomaly, but you know, things
Right.
do happen. You're right. So you do always have to have those background things, but we don't want our clients to see that. So to see those impacts. And that's why we went kind of this direction. So there is some uniqueness to our plan in general to keep those cost savings down. And, you know, at the end of the day, and Ed, you can probably speak to this too, all you can do is quote, see how your numbers come back, and you either take it or you don't, or you find a plan that fits best for your organization. And that's our truly, truly personal choice. We're very happy to be able to offer these benefit packages to keep them all from under one roof, but it's also not required of our clients to be on our benefits either. So, just helps keep that administrative aspect, because we'll handle it all if you are, and there's a lot of value in that aspect. Good question.
Oh,
Hey, Tori, this is Austin with Safe Points. What would be the minimum employees that you would consider then representing for the company?
For healthcare,
Yes.
meaning like, do we have participation rates?
Well, like if I only have 2 employees.
Oh, we'll still cover 2 employees. Yeah.
And what's the maximum?
We don't really have a maximum.
Okay.
Yeah, to be honest, I mean, that's another like little bit of having this multiple, you know, this master healthcare plan. When we have is, before we were so limited to group participation and, you know, hey, you have to have this minimum amount of lives. The only where we kind of have a little bit more control on that, from what I've seen, is more so that if you have a smaller group, you might not be able to offer as many plan options because of your group size, because then we can't spread that risk out as well. So, you know, if you only have 2 employees, you may be be able to offer one plan versus, you know, 3 different plans, maybe 2 different HSAs and a traditional for that matter.
And would you still be able to offer them like a 401k or anything like that?
Yeah. Yep.
Okay.
Yep. And I know Kyle hasn't really hit on the 401k yet, but our 401k plan is exclusive to GMS. It is a multiple employer plan, and we do it through Transamerica, and that's another one where we pull all the assets together. So if you are a 2-employee company and you've never had a 401k before, and you go to start one up on your own, it's probably going to be pretty expensive. Your asset fees are going to be higher. Where we have millions of dollars. Kyle, actually, do you have the most updated figure of how much we have in assets in our MEP? I'll have to find those. I'm like, I don't remember our last little data, but it's millions of dollars. So you're being pulled into that for millions of dollars into those pools, with all of our client base, all of our employee base. So we are able to keep those asset costs significantly down on that aspect, but there is no minimum for participation on the 401k. We want to keep those fees down. Another really good benefit to our 401k is we are the fiduciary because it is our plan. So that means we have to handle all the 5,500 filings. We have to handle all the compliance testing. We have to make sure that all the assets are scrubbed on a regular basis. Otherwise, we can be in violation of other laws. We have a dedicated financial advisory team that also has a criteria to scrub all of those accounts to make sure that everyone's money is being invested. I am on the same plan that every single one of our clients are in. So I want my money to grow, and you do too. So I have skin
Right.
in the game. So GMS better have a good investment strategy as far as the 401k goes. Our 401k is very, very, very affordable as well. We charge a flat fee annually for that. There is no like separate record keeper fees, so on and so forth. And the asset fees are all built in the plan. It's a fantastic low cost option, but it is exclusive to the PEO model.
Okay. So the amount that the employee pays is the same as everybody else,
What do you mean specifically?
no matter how many employees they have?
Correct. So it's just an annual
Okay.
administration fee because we handle all the fiduciary on it.
Okay. Thank you for
So-
answering my question.
Yeah,
Appreciate
no
it.
problem. Go ahead, Kyle.
Thanks, Tori.
Yeah.
And then also risk management, workers' comp. So, instead of, you as the employer going in and having to deal with lawyers and, any kind of, major concerns with your employers, we can also help with that. So safety programs, we also have a risk incentive program as well. That risk incentive program, really making sure that you as the employer are keeping your employees safe. With that being safe, that risk incentive program, if you end up having a great year, no claims, anything like that, you can get up to 20% of your, workers' comp premium back at the end of each year. And other little things to point out from our risk management teams. So, kind of going back in reverse a little bit, and Tori talked about HR and we talked about payroll. We kind of look at everything as a blueprint. That blueprint, everybody talks to each other. What that means is everybody with risk management benefits, so on. So, my favorite story to tell is pretend you have an employee. You get out on a Friday with everybody. Everyone goes out drinking. Maybe you left early and they stayed out for the night. That employee goes home next day, decides to go for a run up Camelback or something like that and hurts themselves. Goes to the doctor. Then Monday comes around and says, hey, I actually slipped and fell at work before we went out for drinks. So the reason I bring that story up is because everyone talks to one another. So that employee went to the doctor. You have healthcare through GMS. Then they file a claim for, workers' comp. And from there, again, everyone's talking to each other. So that employee went into the hospital on Saturday and has a head contusion, but on Monday is stating that they hurt their hip because they slipped and fell, right? So really that's where the risk management side of things comes into play. Making sure that the claims that do come in are actually real and not just someone hoping to get a little extra money. We also have a 24/7 nurse triage hotline. And then from there as well, all the safety different programs. So Paul, he is our head of safety at GMS. Unfortunately, I wasn't able to get him on here, but he's able to go through everything from forklift trainings to, if you have people going up on roofs and maybe we're not being safe, to, the little things and making sure that there are trainings that are involved with that. Now the trainings are an extra cost at a different portion, but that's where we come into play. And so with the OSHA and things such as that, how it really works with him is he'd come in, make sure everything is OSHA certified. That way, if, knock on wood, OSHA does come in the next day, they'd say, wow, this is set up just how we like it. That is kind of how our workers' comp works.
Any questions on workers' comp in general? No, it's always a fun little pain point.
Awesome.
Okay.
And so one of the things I wanted to mention from the very beginning as well. So we talked about the HR and the payroll portion. Everything else is a la carte with GMS. So you have to run payroll with us to be able to get our master healthcare plan through Cigna, to utilize our risk management, to get our 401k, and so on. HR is a part of payroll, but you have to run payroll through GMS to be able to offer these other things, to your company. I'll stop sharing my screen. Oh, nice. Look, this is a good looking screen. Does anyone have any other questions?
What's the cost for workers' comp? Is it based on their salary, or it's just like a basic fee?
So it all depends on what you're doing. So if you're just sitting at a desk all day, you'd be, classified as a clerical worker, but say maybe you are sitting behind a desk half the day, but run out of the office to sell things like myself, right? So I'm at 8742. It all depends on the workers' comp code. And then we make sure that you're a part of that correct workers' comp code. So we go through an Accord 130. That Accord 130 would then, give us a pretty good idea of what things you do, on the safety protocol and the workers' comp side of things. And then from there, we would send it to our underwriters. Underwriters would then put it together and have rates and deductibles for that stuff.
So it's going to vary entirely based on
Yep.
your business, your operations, your manual classes, your loss history. Just like any insurance kind of runs from that standpoint. And we're going to make sure that that risk is properly assessed. And then that gets paid as a percentage of your billable wages. And that is what comes up with your premium. The only difference is that when we have workers' comp billed through us is that we have exact payroll dollars. So when we're looking at, okay, you know, here's your rate, so on and so forth, you're billed per payroll. So there is no audit at the end of the year where you maybe didn't pay enough or you paid too much and you get a refund. Not that that ever happens in workers' comp world, but you're paid per payroll. So you always are paying live premiums rather than doing a full audit at the end of the workers' comp cycle. That's something I really like. Does that help answer your question? Awesome. You're in retail, so retail's not as risky. It can be.
Yeah.
It can be. I worked retail for 10 years
Right.
before this, so loved my retail day. I've gotten poked with a sensor pin a few times. And you never know when you're picking up big boxes of shipment or things like that. That kind of
Right.
yeah, I mean, we totally, we have a few clothing and retail stores. We do a chain of Plato's Closets, Clothes Mentor, all resort, things like that was my favorite because I felt like I still got to visit my retail days with
I
HR.
see. Mhm.
It's in my blood.
Hey, Ed, to answer both your questions, first one, yes, I'm actually working with one right now out of Orlando, PEO Council. And then number two, yes. So if they didn't want to take our healthcare because they didn't like Cigna or Cigna didn't work for them or their doctors or anything like that, even though Arizona does pretty well with Cigna, yes, they don't have to take the healthcare to be with the rest of it. We also offer, I'll say this too, I love to throw this one out here. We also offer a referral program too. So anybody that signs up with us and they, like what they do, there's a referral program too. So, that takes more off of your plate too and off of your amount, for the year.
Other questions? It's okay if you don't, because we did such a good job explaining all the PEO services, right?
Exactly.
I know Kyle and I, Kyle will probably handle kind of dispersing any contact information that we have. So if there's any random one-off questions that you want that are specifically answered to your business or your situation, and how we support, we're happy to answer any of those questions.
Yeah, and anyone on here, if you'd like to get a hold of Kyle or Tori, you can go through me and I will connect you through via email.
Absolutely. Love it. Thank you, Trish.
And actually, if you want, you can, Kyle, if you want to put in the message box here, just maybe your contact information. And then they can take a little snap shot of it.
Yeah, and Kyle will connect anything. He's pretty good about making sure, like, hey, this is definitely a question for me, and he's good at kind of quarterbacking those things along, which I'm appreciative of.
Absolutely. If that's it for you guys, I can go round table and just touch on everyone if you'd like.
Yeah, that's it from us.
Okay, perfect. Great job, guys. Thank you. I appreciate you presenting to the group. And as always, if you guys have any ideas on future presentations, please reach out, email me. I would be more than happy to get you on the schedule as long as it fits the retail end of things and it's beneficial for everyone and educational. So let's go around the room. Let's start with Austin. Austin, what's going on in your world?
Well, it's an exciting world. Like I said, we've been in a company, we've had our company for 5 years. We just launched Save Coins. It's an app that is designed to help consumers save physical cash when they go to a merchant who has the app as well. Like I told you before, an example would be if you go to one of the merchants that has our app, you pay with physical cash. Let's say your burrito cost $9.50 and you hand them a $10 bill. The merchant can now transfer your 50 cents via a QR code and 2 smartphones into your savings account. So we're here to help people and consumers save their money one small deposit at a time, and that's through their loose change.
Love it. Hey, Tracy, how about you?
Within our business or within how this call relates to our business? Because this was a, what are you wanting to hear some feedback on?
Oh, just a little bit of yourself and the company that you come from.
Sure.
But I mean, you share whatever you want to share, like 45 seconds worth of whatever you
Sure.
want to say.
Okay, I just realized I just used 12 of them. So SunMed, your CBD store is our business. We're a modern wellness company based here in Mesa. We have about 400 stores coast to coast, but my wife owns 2 here in Mesa. Just want to bring up July 4th is coming up. A lot of people's dogs are going to be going crazy with the fireworks and the gunshots. So come see us either at Superstition Springs Mall or Power and Broadway. We got some great products to help calming pets and a whole line of human products too. But we'll be happy to chat about that with anyone that comes in.
Thanks, Tracy. Steven, how about you?
Hey everyone, we are gearing up for our planting season. So we offer, if anyone works and plays in Mesa, you do have access to free trees. If you're in the SRP electric area, you have free trees. Also in the Mesa electric area, and then we'll be doing some tree plantings in the Mesa community. So if anyone lives in Mesa, please take advantage of those opportunities. Thank you.
Thank you. And Dr. Charlotte.
Hello, everyone. So my name is Dr. Charlotte Goudelet. I am a subsidiary of Save Coins, LLC, so CMG Strategies, and I support career coaching, manager success, role-specific training, succession plans, and training department support. So if you're interested in training for complex challenges, such as how to adapt and acquire new skills that support industries, my industry experience is grocery retail, construction, airline, manufacturing, finance, and others. And again, we're here to deliver and facilitate impact-filled programs.
Thank you.
Thank
All right,
you.
Daniel French.
How are you guys doing? So yeah, like I said, we've been here for 58 years right here, same location, Main Street and Country Club. Carry all major appliances. We have some good deals coming for this 4th of July and rebates. If anybody interested, anybody needs any appliances or anything. But yeah, been here forever and we'll price match anybody. We'll beat anybody's price.
Okay.
So,
I love
thank you,
it.
guys.
Hey, Daniel, when you're able to send me a digital flyer so we can put it out.
Oh yeah. I will get that sent to you. I'm sorry about that.
No worries. All right, Brandy Anderson, what you got going on in your world?
Good afternoon, everybody. This is my first retail committee meeting, so I really enjoyed the presentation. I think you guys did great. I'm with Country Financial. I do all of your insurance needs except for medical. So I could do your life insurance, auto insurance, your business insurance. I also help with retirement and financials. So just a little snip right now, we're changing seasons, monsoon season's coming, the rains are coming. So I would just encourage you all to get your ACs checked, make sure your drip cans for your condensation trays are being cleaned out. Otherwise, those could overflow, cause roof damage, ceiling damage, and turn into a home insurance claim. So just make sure you get those checked seasonally so that you don't have to run into any major issues.
Perfect. And Leon, you are next, sir.
Yes, I've been in business now for 3 months, so I'm a baby with the retail. But we have tuxedos and different things for like graduation or weddings or what have you. I have my connections that I could call and get something if I don't have it on site. But it's going well so far, so good. But we just doing our best to do what we can.
Perfect. Thank you. Thanks for coming into the retail group.
Absolutely.
David Scott, Meadows Bank. What's up, sir?
Well, I'm fortunate to be spending almost all of my time nowadays on the community building activities that I'm involved in, and in particular focusing on our East Valley communities. So not just in terms of community organizations and nonprofits, but our business community and everything that's going to go to benefit our town and make it a better place to be. So I spend a lot of time delivering resources both internally and externally from the bank and all of the people that are in our network to help our members, to help our community and everything like that. So it brings me a lot of joy to do that, and I hope to continue doing that for a long time.
That's great. All right, Ed Tobin. What's going on in your world, sir?
Sorry about that. I was muted. So I just got back from Sedona. I spent a week there at 75 to 85 degree weather. So that was awesome. I'm looking forward tomorrow to leaving town and going up to Prescott for the 4th of July and the Prescott Rodeo, which is going on up there, which is always a great parade and it's a great celebration. So fortunately, I'm getting out of Phoenix and not spending so much time here. However, I will tell you this, business is really booming. It's good when you can help small businesses out. And I really appreciate the presentation today. Look forward to maybe having an opportunity to work with you guys. I've got some clients that I would like to work with you on and transition over. So we'll stay in touch. Thank you for today's presentation.
Perfect. And we heard from Tori and Kyle today, so we are good there. Is there any last minute, any things you guys can think of? Otherwise, I think we're right on time, 4:57. Great job, you guys.
Thank you, Trish, for putting this on for us. Appreciate your time.
Yep,
Yeah,
absolutely.
thank you for taking the time.
Yeah, absolutely. And like I said, if you guys find that you would like to present, please email me. I've got spots open. So, or any suggestions, you can email me. I'm always open for suggestions.
Absolutely. And Trish, we do offer too, if you guys ever need like any like little education topics, I know that was a big thing on education aspect. If you guys have like a specific HR related topic that you just kind of want to know a little bit more about, I can do a kind of a little 30-minute debrief to give you guys some tools from that standpoint.
Wonderful. All right, guys, I think we could wrap it up. I look forward to seeing you guys next month. And looking forward to my presenter, who I don't know who that is yet. So
All
I'm
right,
sure
thank
it'll be
you.
great, whatever it is.
Bye.
Thank you.
That's,
All right, guys, take care.
go.
Take care.
Bye.
Bye, everybody.
Hi, everyone.